Hi everyone, good morning. Just waiting for Emily to join and then we'll get started. Go live. Uh-oh. Emily, are you there? Let's try that. There we go.
All right. Perfect. Can you see me?
Yes, I can see and hear you.
All right. I'm trying to figure out how to. All right. I can't see myself for some reason, but great. I guess as long as I'm in frame, I will trust that I see me and hear me.
Yes, you are there. So we've got a couple people here, so we'll just get started.
Perfect.
That
So
sounds
sorry
good.
for difficulties. This is actually my first time doing live, so I was like, join, but
Yes, I practiced yesterday. So I'll just do my little intro. So, good morning, everyone, and thank you so much for coming. My name is Jenna, and I'm interning this summer with JFF. The Jewish Fertility Foundation provides financial assistance, emotional support, and educational programs like this one to Jewish individuals experiencing medical infertility. So I am working on creating genetics educational materials with them, and I thought there wouldn't be a better way to do it than to collaborate with JScreen. So today we have Emily, who is a genetic counselor for the JScreen program. She received her bachelor's degree from Brandeis University and her master's degree from Sarah Lawrence College, and has been certified by the American Board of Genetic Counseling since 2011. So thank you so much for being here this lovely morning. I've got my homemade iced coffee.
water because I'm just not a coffee drinker. I don't know why, never, but I hope everybody else is having their coffee.
Oh, good. So if we should just jump into the first question I have here. So first of all, just tell me what is broadly reproductive carrier screening?
Perfect. So we'll keep it simple to start. So reproductive carrier screening is basically undergoing genetic testing to determine if a couple is at a high risk for having a child with a genetic condition. And so it's usually done by either blood or saliva, and we'll talk a little more specifically about how to do it. But essentially, it's a genetic test, and it looks at genes of the parent, not to tell them anything about their own health, but to see if there are any genetic changes that could impact the health of their children. So for most of these conditions that we test for, they're what we call autosomal recessive. So bringing you back to biology class a little bit. So we typically have two copies of each gene because we get one from the egg, one from the sperm. And in general, for a lot of these conditions, if we have one copy that works, that's enough to keep us healthy. If we're a carrier for something, it means we have one normal one and then one has a genetic change that makes it not work right. Carriers in general don't have any health conditions. It doesn't usually affect them, which is why we would never know about it unless we specifically check for it, because it wouldn't otherwise show up in our health history or family history. But if we're a carrier and the reproductive partner that we have is also a carrier for the same condition, then anytime they have a pregnancy together, there's a 25% chance, or 1 in 4, that they both pass on a copy of that gene that doesn't work. And then a pregnancy ends up with 2 abnormal copies, and that's how they get these conditions. So in general, it matters what's coming in the egg, what's coming in the sperm. And by genetic testing, we can look at the biological parents and let them know if there's any overlap in the conditions that we screen for. There are some conditions that are what we call X-linked, which means they're typically passed on from females. And in some cases, it really doesn't matter the male's results, because a female can have a child with those X-linked conditions regardless of her partner's results. So in general, most conditions that are screened for are recessive and coming from both parents, but there is a small proportion that are X-linked.
Awesome. So why is it important as a part of planning for pregnancy?
So that's a great question. And people often think, should I do this before pregnancy? Should I do it once I get pregnant? In an ideal world, this is done as part of pregnancy planning. The same way, you want to get all your other health stuff in order, start taking prenatal vitamins, start looking at your finances. This is all, one of those aspects of planning for children. And the idea behind doing genetic testing is figuring out ahead of time, when the stakes are not as high, if you're at risk of having a child with a genetic condition. And by knowing this ahead of time, then this can give you information to prepare for the future. So this could mean a lot of different things for a lot of different people, depending on what you tested positive for, what your fertility plans are, what you would do with the information. So it's a really complex question and really personalized on what you would do with the information, but you can't really make any of those decisions or have those conversations until you do your testing and you know what types of things you may be at risk for.
So this is why when someone applies for a JFF grant and they're accepted, that part of their grant is that the 2 parents get a JScreen test, because it's such an important part of the pre-planning.
Exactly. And there's a couple different ways that people can use this information. Now, again, most people who do our testing, we're giving them good news. We give them the green light. Go ahead. Nothing else to do from a genetics perspective. But just to kind of focus for a minute on the small percent of families where we find that they are at increased risk. So there's a few things that people can do. So the first thing is talk to your genetic counselor. They'll walk through all these different options with you. But some couples will say, okay, based on what we're a carrier for, we want to get pregnant naturally and then find out if the baby has that genetic condition after they're born. We'll have the pediatrician or geneticist test them and then treat as needed. Another option is, again, getting pregnant naturally, if that's an option, and doing genetic testing during a pregnancy to figure out if that fetus is affected or not. So that can look something like an amniocentesis or a CVS. So these are procedures where usually they use a thin needle to take a sample from the pregnancy, either amniotic fluid or placenta, to check during pregnancy if that fetus is affected, and then either prepare to have a child with that genetic condition and have that knowledge ahead of time, or decide to terminate the pregnancy. If you're doing this testing pre-pregnancy, you also have the option to use assisted reproductive technologies. So some couples choose to do in vitro fertilization, which this audience may already be somewhat familiar with, but to make it really simplified, you take sperm, you take
Uh-oh. There you are. You're good. Keep going.
Oh, am I? Okay. So you take egg, you take sperm, those are combined in the lab, and then you create embryos. And these embryos, you can then do a little tiny biopsy. You're selecting just a few cells, and then you can actually do genetic testing for the genetic condition that you're worried about, and then basically select embryos that you know are unaffected.
Hmm.
So it's still, we still recommend you confirm it during pregnancy, but it basically takes that 1 in 4 and tips those scales, because you're selecting embryos that are super, super unlikely to carry those genetic changes. Um,
So just to oh, so just to summarize quickly, someone's plan for conception, whether it be like IVF, IUI, or naturally, could change based on the results they get from their
yeah.
test.
So if you have a couple who are going through IVF already outside of genetic testing, this is important information to know because you're already doing IVF. And if you find that there is a genetic condition that's at risk, then you can do this extra level of testing. It's called pre-implantation genetic testing, and then check those embryos before you use them. So for people that are already doing IVF, this is a way of, checking ahead of time if there's anything else that you should be doing along that process. For couples, let's say they don't have, or at least they don't know of any issues with fertility, and they would have really no reason to undergo IVF, they might do a genetic test, find out they're at risk, and then choose to do IVF to screen for those embryos, even though it's not because of reasons of infertility.
Okay.
So, these are different steps you can take if you know ahead of time. Some couples also can choose to use donor egg or donor sperm, to, select a donor that they know is not a carrier for that particular condition. Some couples who are doing fertility treatments are coming through and selecting sperm and egg donors either for fertility reasons or same-sex couples or, post-cancer treatments. There's a lot of other reasons why people are using donors, but it's important to take into account the fact that you want to make sure that that donor has been screened for any conditions that you may be a carrier for. And then for any egg donors, you also want to make sure they've been screened for these X-linked conditions, because that wouldn't be impacted by the sperm's results.
Definitely. So, besides the conditions on the carrier screening panel that a couple can pass on, those autosomal recessive disorders, can a genetic test tell anything about a person's fertility?
So it's a complex question. In general, it would be great if we had a crystal ball and we could do a genetic test and tell couples ahead of time, you know what, don't spend 3 years trying to conceive on your own. We know that you need XYZ fertility treatment. I think that would save people a lot of time and a lot of heartache. And we're not there yet. Maybe one day. But that being said, if somebody is experiencing infertility or recurrent miscarriages, it still may be worthwhile to meet with a genetic counselor. Again, carrier screening for all the reasons we talked about, but there may also be other genetic testing, like looking at somebody's chromosomes to see if there's an explanation for recurrent miscarriages, or maybe their infertility is occurring because of primary ovarian insufficiency, which means sort of going through menopause at an extra young age. There are some genetic causes for that. So even though carrier screening is probably not going to give you that answer, it may still be worthwhile to meet with a genetic counselor and talk about different options for genetic testing that may give an explanation, or potentially things to know about in planning for pregnancy.
Okay. To go back a little bit more broadly about what you do, how does JScreen work and how can someone get genetic testing?
So JScreen is one option for reproductive carrier screening. It's convenient because it's done at home. As you mentioned, anyone receiving a grant from JFF is, given a free JScreen test as part of their fertility treatments. But basically what happens is people can go online to jscreen.org. So we're a nonprofit. We're based out of Emory. And our goal is to really make this type of testing affordable and accessible to anybody planning a pregnancy so that they have this information and they have all of these options. So we wanted to make it as easy as possible. So you go online and you register for a kit, and then that it's a saliva kit. So you actually spit in the tube. So it comes to your door in the mail. You spit into your tube, you get it sent back. And then once those results are ready, then you'll be notified that your results are available, and you can set up an appointment with myself or one of the other genetic counselors, and we'll walk you through those results. So in case you didn't memorize everything that we talked about, we can go through what the results show. We compare them, with a partner if you have one, and talk about any future risks and any options that might be available depending on what we find. So it's all done from home. It's affordable, but we have financial assistance for anyone who needs it. And genetic counselors there the whole time. So if you come up with questions or there's any issues, you can certainly let us know. We also work with your healthcare provider. So the same way, like if you were referred to a local genetic counselor, your doctor gets a copy of the results and a copy of the whole consult letter. So that way they have all the same information that we do so that they can take care of you for any next steps.
And is it recommended / available to everyone?
Yeah, so reproductive carrier screening, we recommend for anybody who is planning a pregnancy. And the panels nowadays are so broad. There are more than 200 different conditions. Each gene is checked really, really closely. So, we often think about the fact that people who are Ashkenazi have higher risks for things like Tay-Sachs or cystic fibrosis, and that's definitely true. But we also know that there are, people can be carriers of a genetic condition regardless of their ethnicity or their background. So it's recommended for everybody in the general population. That includes couples who are interfaith, interracial couples, LGBTQ plus families. Again, as I mentioned, people who are using donors. So really, we recommend it for anyone planning a pregnancy, regardless of who they are or what their situation is. Because again, since it doesn't have any symptoms, and most people who are carriers for conditions don't have anything in their family, there's really no other way to know than to specifically test. And some people find this surprising, but we find that about 80% of people that we test are carriers for at least one thing. And usually it's a few things, anywhere between 1 to 8 different things. So people often find that surprising. But again, most people that we're testing and we're comparing with their partner, we give a lot of good news, and it's just reassuring information to go forward, but sort of important regardless of what those results show.
I've also seen that JScreen has a new test called CancerGen, and could you just explain what that is and how it might impact someone's fertility treatment or journey?
Yeah, of course. So we've been doing reproductive carrier screening for years. And then we started getting a lot of questions, if any of the genes they were tested have anything to do with cancer risk. So for people who have heard of BRCA, BRCA1 and 2. So these are genes that if they don't work properly, people have extra high risks for certain cancers. So BRCA in particular, as an example, people who have a change in one of those genes have higher risks for breast, ovarian, pancreatic cancer, prostate cancer, melanoma. And the idea behind doing genetic testing is finding people with those extra high risks so we can offer extra screening and prevention. So the beginning of this year, we launched our CancerGen test, which specifically checks over 60 genes that are related to cancer predisposition. And so it has that same model, it's done with spit at home. A genetic counselor goes through those results when they're back. But it's really focusing on the individual's health, though it actually does have implications for parents, siblings, children. But unlike carrier screening, where we're usually not giving any information that's going to change your medical management, this one really does. And we believe the more you know about your cancer risk, the more you can arm yourself with the information to, go through the motions of extra screening, prevention, even preventive surgery that we wouldn't be able to do if we didn't know about that risk. Now, some couples are choosing to actually do reproductive carrier screening and cancer genetic testing at the same time. Because again, if we find, for example, that somebody has Lynch syndrome or a BRCA mutation or another cancer predisposition gene, then they also have those same options of in vitro fertilization and doing testing on embryos or egg or sperm donation to avoid passing on those genetic changes. So in some cases, couples want to do this at the same time, especially if they're already doing IVF, or would consider doing IVF if they knew they carried one of these changes. I think it's especially important to highlight the fact that certain cancer treatments can impact somebody's fertility. So we know chemotherapy or sometimes surgery to remove somebody's uterus or ovaries. Obviously, those are going to have big impacts on somebody's fertility. And so a test like CancerGen with reproductive carrier screening can be an option for some people, both to help them figure out maybe where their cancer came from, if there's any risks for the future. Is there something that we want to think about in terms of passing on, those cancer predisposition genes, especially for maybe somebody who's about to start chemotherapy and they're freezing their eggs or sperm or embryos, and they want to know risks for them that could impact their cancer treatment, but also for their future kids that hopefully they'll be able to have down the road. There's so many uses for it, ranging from personal health to cancer treatments to fertility preservation to family planning down the road, that we felt like it was an important test to start offering.
Definitely. And my last question before we open it up, once a couple does genetic testing, do they ever need to do it again?
So it's funny because our genes never change. So theoretically, the answer should be no, we've looked at your genes and now we know everything, and that never changes. But realistically, the answer is yes. And that's really because even though our genetic information doesn't change, the technology and our scientific knowledge does. So if you had testing today for 250 genes and you're on to kid number 3 in 5 years from now, I can almost promise you that we're going to be testing for a lot more genes then than we are now. So we always recommend for the reproductive carrier screening to circle back with every pregnancy. We might come back and say, you know what, you're still good. Nothing's changed. You're free to go. But oftentimes, every couple years, the panels change. We have more diseases. We get better at looking for genetic changes within those genes. So we recommend, shooting us an email or checking in with your doctor or genetic counselor to say, I was tested in 2018. Is there anything I should be doing now? And same thing goes for the cancer genetic testing. So, when I started working as a genetic counselor, you could test for, I think if you looked at all the genes out there, it was maybe 5 to 8 genes that you could test for. And now you can do 63 genes all at once. So again, there's going to be big changes over the next few years to cancer genetic testing as well. So I say it's an easy question to ask. Circle back with your genetic counselor and see if there's anything new that we'd recommend, just in case.
It's like an old field, genetics, but at the same time, it's so new and everything's changing so fast that no one can keep up with it.
Exactly. So it's a full-time job, I will tell you, to keep up with the new changes in genetics. It's why I have a job, because everything changes. And there's always new discoveries and new information to keep on top of. So we can't expect everybody. So that way, we're doing that. We'll do all the heavy lifting. So, check in with your genetic counselor anytime you're planning a pregnancy and see, what else new is out there.
Totally. Well, thank you so much, Emily, for being here this morning. And if we have any questions from our audience, we'd love to answer them. Otherwise, have a great day, everyone. But feel free to ask a question in the comment section.
Yeah, and if anyone has particular questions, make sure to follow us at Get JScreened. That's our Instagram handle, which I'm not using right now, but we'll post it. And go to our website. We have videos. We have a lot of information. All of our contact information is there as well. So if you want to reach out because you have a specific question, we're always here to help.
And same here at JFF. Well, I haven't seen any questions come through, but we'll wait a little bit longer and then we can sign off.
That's good. I'll drink fake coffee at the time.
Yeah, there we go. At 10, we'll sign off.
All right,
So we'll give it 2 minutes.
perfect. Any JFF news that needs to be gone over or housekeeping?
I think we've got some fun events coming up the rest of the summer, so just keep your eyes peeled for those. And I think that's it.
All right, perfect. Well,
I think we're good to go.
Great chatting with you.
Yes.
Everybody out there, feel free to message us with any questions. Let us know if there's anything that we can do. And otherwise, good luck with all of your fertility journeys.
Bye, y'all. Thank you. Bye, Emily.
Bye.